Hello everyone, my name is MUSTAFA Khalil, third medical student, and I will talking today about the coronavirus disease, COVID-19. 8 million people was infected and half million die until today, and our life stood up because of it. So what's the coronavirus history and pathogenesis and how we can diagnose it and treat if there are treatment actually. So all these points we will discuss in this seminar with my colleague QAIS and ABDLIMALIK MAWAN. Yes, I will start with the history of the coronavirus. Research first identified coronavirus in 1937, isolated one that was responsible for a type of the bronchitis in bird that had the potential to devastate poultry stocks. After years, scientists found evidence of the human coronavirus in 1960 in the noise of the people with a common cold, like any influenza. Illness in the human is most respiratory or gastrointestinal infection. However, the symptom can range from the common cold to more severe lower respiratory infection, such as a pneumonia. Among the human, coronavirus infection most often occur during the winter month and spring. Zoonotic disease. Coronavirus family is a zoonotic disease. Its mean transmissions from the animal to human. In this slide, we see the most important two terms, epidemic and pandemic. Epidemic is a term that is often broadly used to describe any problem that has grown out of the country. Pandemic is used to describe a disease that affects a whole country or the entire world. Coronavirus, large family of the viruses that cause the illness from the common cold to more severe disease. Actually, the first urgency of this family is a severe acute respiratory syndrome, SARS, first identified in 2003 in the China, killed about 650 people, and it's a transmission from the bat, so it's a zoonotic disease and epidemic. After a year, the second urgency of this family, Middle East respiratory syndrome, MERS, first identified in Saudi Arabia 2012 and killed about 800 people. It's also transmissions from the camel, so it's a zoonotic disease and epidemic. COVID-19 was discovered at the end of the December 2019. Chinese doctor in the Wuhan city called Li Wenling reported unusual case of the acute respiratory syndrome. Dr. Li sent a message to the fellow medics in a group chat on 30 December to warn them about the virus, and days later was summoned to the Public Security Bureau to sign a letter in which he was accused of making false comment. Unfortunately, Dr. Li early on Thursday morning died at 34 years old. The first people with the COVID-19 had linked to the animal, pangolin, and seafood market. This suggests that animal initially transmission the virus to the human, so suggests it's a zoonotic disease. The COVID-19 is a pandemic. It's rapidly evolving and outbreak investigation or ongoing. The stage of the severity. In this slide, we see the stage of the severity of the COVID-19. Mild disease, more than 80%. Severe disease that causes the shortness of a breath and pneumonia around 40%. Critical disease that causes the septic shock, respiratory failure, and the failure of the more than one organ about 5%. Fatal disease cause 2%. Incubation period. According to the CDC, the novel incubation period of the novel coronavirus is somewhere between the 2 to 40 days after the exposure. One study reported that 97.5% of the people with the COVID-19 symptoms will appear about 11 days. Based on modeling studying infectious was estimated to start from the 4 and peak at day 7. Over the course of the infections, the virus has been identified in respiratory tract specimen 1 to 2 days before the onset of the symptoms, and it can persist for up to day 8 in the mild case, and for the longer period in more severe cases, peaking in the second week after the infection, which peak at around 10 days after the symptoms onset. R0 is a really important slide. R0, it means how quickly it spread. If they are not equal 1, it means the virus transmissions and spread from the 1 people to another 1. If are not equal 2, it means the virus, its transmissions from the 1 people to 2 people. So it's how quickly it spread. Coronavirus COVID-19, the R naught is equal 2 to 2.5. So it's really dangerous in spreading and transmissions. According to the statistics, if the coronavirus continue its spread, may 70% of the all people and populations in the all countries infected in this virus in 2021. So it's a really dangerous virus. The structure of this virus is a spike glycoprotein, hemagglutinin esterase, M protein, E protein, envelope, and RNA and N protein. Yes, my colleague ABDLIMALIK will contain with the pathogenesis of the COVID-19. Thank you.
Thank you very much, Mustafa. Now I will talk about pathogenesis of COVID-19. The coronavirus must infect living cell in order to reproduce. Inside the virus, genetic material contains the information to make more copies of itself. A protein shell provides a hard protective enclosure for the genetic material as the virus travels between the people it infects. An outer envelope allows the virus to infect cell by merging with the cell's outer membrane. Projecting from the envelope are a spike of the protein molecules. Both atypical influenza virus and the new coronavirus use their spike like a key to get inside a cell in your body, where it takes over its internal machinery, repurposing it to build the components of new viruses. When an infected person talks, coughs, or sneezes, droplets carrying the virus may land in your mouth or nose and then move into your lungs. Once inside your body, the virus comes into contact with cells in your throat, nose, or lungs. One spike of the virus inserts into a receptor molecules on your healthy cell membrane like a key in a lock. This action allows the virus to get inside your cell. A typical flu virus will travel into a sac made from your cell membrane to your cell nucleus, that where your cell houses all its genetic material. The coronavirus, on the other hand, doesn't need to enter the host cell nucleus. It can directly access part of the host cell called ribosome. Ribosome use genetic information from the virus to make viral proteins such as the spike on the virus surface. A packaging structure in your cell then carry the spike in vesicle when merged with your cell's outer layer. All the parts needed to create a new virus gather just beneath your cell membrane. Then a new virus begins to bit off from the cell membrane. Okay, so continue with pathogenesis. How receptors that enable novel coronavirus enter the human cell? ACE2. Angiotensin converting enzyme is a protein on the surface of many cell types. It's an enzyme that generated small protein by cutting up the larger protein angiotensinogen. It's found in lungs, type 2, pneumocyte, heart, blood vessels, kidneys, liver, GIT, and testes. But what mean more ACE2 receptor, more severity of disease? Some studies say that hypertensive patients who take ACE2 inhibitor are more susceptible to novel coronavirus infection and more severity of symptom. Okay, here's the structure of the virus. Show S a protein which bind to specific site of ACE2 enzyme by activation of a transmembrane protease serine 2 enzyme. This enzyme can block action by some medication such as nafamostat. Now, explain how COVID-19 affect on your body. As you know, the virus is foreign body and our immune system will be fight it. Here lie a big problem. immune response will be destroy our body tissue more than the virus. So, immune response to COVID-19 infection has two phases. Phase 1 appear moderate symptoms of inflammation and cytokine response used to eliminate the virus, while phase 2 appear severe symptoms due to hyperinflammation which cause destruction of lung tissue and become uncontrolled inflammation. This condition is called cytokine storm. Severe symptoms can result in severe tissue damage and acute respiratory distress and eventually cause death. Patients with the severe COVID-19 demonstrated lymphocytopenia and high level of interleukin 6, interleukin 10, tissue necrotic factor, alpha. High level of cytokine cause systemic inflammatory response and many organs will be affected. Some complication of COVID-19 is acute respiratory failure, pneumonia, acute respiratory distress syndrome, septic shock, acute liver injury, acute kidney injury, acute cardiac injury, disseminated intravascular coagulation, and neurological disturbance. The most complication of COVID-19 infection is acute respiratory distress syndrome. Is a sudden progressive form of respiratory failure characterized by severe bilateral infiltrate. As we know, the alveoli sac composed of two different cells, pneumocyte type 1 for gas exchange, while type 2 for surfactant substance, production of surfactant. And alveoli will be surrounded by meshwork of capillary vessel called pulmonary capillaries. Here see the leaky endothelial vessel due to cytokine of dust cell macrophage of alveoli. This exudate will build up in interstitial space forming scar tissue, and inside alveoli filled it by protein-rich fluid with neutrophil migration. This condition is pneumonia. Result of this pneumonia: fluid built up, blood more susceptible for clotting, destruction of pneumocyte type 1 and 2, and production of hyaline membrane. Histopathological of acute respiratory distress syndrome. At this stage, the surfactant that helps keep alveoli from collapsing has been diluted, and the fluid containing cellular debris is impairing the gas exchange process that supplies oxygen to our bloodstream. In the most severe cases, systemic inflammatory response syndrome occurs as the protein-rich fluid from the lungs enters the bloodstream, resulting in septic shock and multi-organ failure. This is often the cause of death for people who have succumbed to COVID-19 infection. COVID-19 infection can affect in our heart, cause acute cardiac injury. There are two dominant cardiac issues related to COVID-19. First one, heart failure, when the heart muscle doesn't pump blood as well as it should, and arrhythmia or abnormal heart rhythm that can be related to the infection or to the effect of medication used to treat the virus. Second one, heart failure can develop due to systemic inflammatory response to the infection, high lung pressure from lung damage, or occur from heart inflammation known as myocarditis. Also affect in kidney cause renal injury. Kidney injury can be caused by direct damage of tissue by virus through its tropism, ACE2 receptor, due respiratory dysfunction, hypoxia, cytokine storm destroy renal tissue, severe inflammation in kidney, and blood clot that might clog the kidney renal infraction. Now, with my colleague, guys, continue with diagnosis of COVID-19.
Thank you, my colleague Abdelmalik. Now, with the diagnosis of COVID 19, which is the last part of our seminar. Now, in the beginning, currently, there is a four method for diagnosis COVID 19. In the beginning, we have detection of the virus using PCR test, non PCR test, chest CT scan and radiograph, and the last one, which is detection by the antibody. PCR, or what's called polymerase chain reaction. Tests can detect even a small amount of material or viral genetic material in a sample by duplicating it to many over and over times through a process called amplification. A test sample which is swiped up from the patient, whether from the back of the nose, whether from the throat, even if it was in the deep airway, swiped up by a catheter, it doesn't matter. What matters to us that we have a sample. This sample undergo to isolating for genetic material, and small pieces of specifically engineered genetic material are called prime are introduced and bind to the isolated viral genetic material. Initiation was called amplification. The last one, which is the fluorescent marker bound to the copies during PCR, are released and can be detected when amplification is occurring. PCR tests are reliable and available within a few hours to 2 days. The RT-PCR test performed through throat swab is only reliable in the first week of the disease. Later, the virus can disappear in the throat while it continues to multiply in the deep airway of the lung. For infected people tested in second week, alternative sample material can then be taken from the deep airway by using a catheter or coughing up material sputum. Now the WHO put a specimen rejection criteria that we have to follow to have a best sensitivity and best specificity. That we have a temperature that we have to follow, which is none below 4 or to 8 Celsius, not less than 4 days, incomplete specimen or labeling or documentation, inappropriate specimen type, insufficient specimen volume. Now with the second one, which is non-PCR test. The Food and Drug Administration has approved a new test by Abbott Lab that use isothermal nucleic acid amplification technology instead of PCR. Since this does not require a time-consuming serious alternative temperature cycle, this method can deliver a positive result in as little as a 5 minute and a negative result in a 13 minute. We talk about the PCR test. We said that they are available within a few hours, to 2 days. Now we have this test that we have a reliable and available result from 5 to 13 minutes. There are currently 18,000 of these machines in US and about expected to ramp up manufacturing to deliver 50,000 tests per day. Detection of the antibody. Part of our immunity response, as we know, to infection is a production of antibody, include IgM, IgG. These can be used to detect infection in individual starting 7 days or so after the onset of the symptom to determine immunity, and in population surveillance. Assay can be performed in a central laboratory or by a point of care test. Now with the last test, which is chest CT scan and radiograph. At March 2020, literature review conclude that chest radiographs have a little diagnostic value in early stages, whereas CT finding may be a prescient event before symptom onset. A small study showed that Chinese radiologists demonstrate 72 to 94 sensitivity and 24 to 94 specificity. So that's really good, but not good enough for a definitive diagnosis. And differentiation COVID-19 from other type of viral pneumonia using CT scan. Now we have some questions and cases about COVID-19. You can try to test yourself and answer them without see the result. Now, COVID-19 mask can be sterilized and reproduced again. And you have MCQ. What do you think? We can do it or we can't? The answer is C. The face mask cannot be reproduced. Face mask includes surgical face mask N95 makes mask should not be reproduced if if they are in contact with a person infected with a new coronavirus or another respiratory infection. The front of the mask is indeed contaminated, and the mask should be removed without touching the front and dispose of it properly. After removing the mask, the hands should be washed too with soap and water, or we have like alcohol. Can thermal scanner diagnose coronavirus directly? For sure. Do you think that's true or false? Actually, that's false, because thermal scanner can detect whether someone have a fever or not. So they cannot make sure that someone have a COVID-19, maybe have another viral infection, but it can use as a cofactor in pandemic. Now, can home remedies cure and protect against COVID-19? Some home remedies like garlic can protect against COVID-19. B. No. Home remedy cannot protect against COVID-19. C. Yes. Home remedy can protect against COVID-19. Actually, the answer is no home remedy can protect against COVID-19. Actually, there is no cure until now. The best approach is to adopt a good hand washing and hygiene regime and avoid places where there is a maybe unwell people. Now, can a woman with a COVID-19 breastfeed? Yes or no? Quickly, yes or no? Actually, yes. Women with a COVID-19 can breastfeed if they wish to do so. They should practice respiratory hygiene during feeding because can be transmitted by respiratory, wearing a mask where available, washing hands before and after touching the baby. Now, the most important questions. A pregnant woman was infected with the SARS-CoV-2 in the 3rd month of gestation, so her child will be infected or not? What do you say? Quickly. Yeah, actually, one study published recently in the Lancet found that 9 women who become infected with COVID-19 did not pass the virus to their babies. Another questions. How long will it take to develop a vaccine? That's actually very, very good questions for me. It will take month to year. Impossible to find a vaccine. Or C. Oh, it's easy to find a vaccine. Go to the pharmacy. The explanation is answer A. The development of vaccine unfortunately take times. Several pharmaceutical companies and research laboratories are working on vaccine candidates. It will, however, take a month to year before any vaccine can be widely used. as it needs to undergo extensive testing in a clinical trial to determine its safety and effectiveness. These clinical trials are an essential procedure to regulate approval and usually take place in 3 phases. Now we have a cure which is just past the phase 2 and he is in his way to phase 3. So God help us. Thank you so much for your good listening, and I hope we will meet again.